Thank you for joining us. Welcome. 83, that is the number of people who have lost their lives, and get this, just this week alone due to the coronavirus pandemic. The surge in the number of deaths and new infections is now becoming a cause for concern among medical experts in the country who believe that Kenya could be slipping back into dangerous territory when it comes to the fight against COVID-19. And as Kenyans' Timothy Otieno now reports, infectious disease experts are warning that a lockdown may be the only way to keep Kenyans safe from the deadly virus.
947 people tested positive for the coronavirus on Saturday, adding to a list of over 4,000 new cases of COVID-19 reported in just 1 week. It's a trend that is now becoming worrying for medical experts in the country. Just this past Thursday, Kenya recorded its highest infection rate ever, with 1,068 positive cases reported in 1 day. The tally adds to a week of infections that has concurrently seen a heightened political atmosphere occasioned by the anticipation of the BBI report and Mashujaa Day celebrations, which saw large political gatherings and little adherence to containment measures.
I want to propose.
Just last month, the president sounded a warning on the worrying trend in the country.
We thank Kenyans, but it is we, the political class especially, that is leading the charge in defying laid down protocol. So hii ugonjwa ikiendelea kusambaza, tujiangalie sisi wenyewe mbele ya tuanze kuangalia wananchi.
But it's statements like these, issued without necessary accountability, that infectious disease specialist Dr. Mary Beth Maritim believes is Kenya's biggest undoing in the fight against COVID-19.
This is really where we should hold our political leaders accountable, because they are really the role models, and they need to lead by example, by showing that they understand COVID is real and that all the people who are coming to their gatherings are at risk of getting COVID-19, and therefore we should hold them accountable.
But the gatherings come nearly a month after the president eased restriction measures meant to contain the spread of the virus.
Unaweza kukunywa pombe, sawa?
With the opening of entertainment joints, easing of gatherings for religious institutions, and phased reopening of schools, Dr. Mary Beth believes the country is flirting with disaster.
People are feeling more and more safe. They have this sense of safety, yet actually the number of cases are going more. And maybe this is also contributed by the fact that we know that a lot of our COVID cases are largely asymptomatic or mildly symptomatic. So people feel that even if they got the infection anyway, they'd have a mild disease or asymptomatic.
But argument is also rife that the increase in number of cases can be attributed to the renewed efforts to have mass testing conducted across the counties. With 896 deaths recorded so far in the country since March, medical experts warn that lifting of restrictions may not be such a good idea. Do you feel like the president should reinstate some of these measures that he eased or lifted?
It's really a very tight balance between reopening up or easing the restrictions, as well as even balancing that vis-a-vis the risk of putting in place the restrictions to limit the spread of COVID-19.
With an average infection rate of 12.2% over the last 7 days, it appears previous gains made by Kenya to flatten the COVID-19 curve may be eroded if advice from medical experts is not seriously taken into account. Timothy Otieno, KTN News.
Let's stay with health issues.